My name is Dr. Theophilus Umeizudike. I'm a consultant nephrologist at the Lagos State University Teaching Hospital. Looking at this topic, I will just paint a scenario before you to give you the magnitude of what we're dealing with. A few years ago, somebody was brought into the emergency room of the hospital where I was working then. And prior to that time, the person never knew he had high blood pressure. And on admission, he was found to have a blood pressure of over 200 systolic and over 130 diastolic. At the end of the day, it turned out that this person actually had what's called partial stroke or transient ischemic attack. Alongside having that incident, he also, in the course of evaluating other aspects of bodily function, we discovered that he had kidney disease. His serum creatinine and blood urea were markedly elevated. And at the end of the day, this middle-aged man had to initiate dialysis. And so you discover that this is something that's like a time bomb that affects people in their prime of age, when they should be contributing meaningfully to the society, when they should be making a means of livelihood that should keep them in the workforce. They just discover that they have to spend all that they've labored for on their health. And this ultimately has negative effects on both themselves, their family, and even the organization they work for. So if you look at it critically, you discover that kidney problem is something that is in an epidemic proportion in our country, as well as all over the world. In developing countries generally, you discover that kidney disease tends to affect the younger population. This might not be unconnected with the fact that we have a younger population as compared to the developed worlds, and the current pandemic of COVID-19 has also shown a similar pattern in which you discover that the way and the pattern in which it affects developed countries is quite different from the way it's affecting Africa. And this is majorly because we have a very young population. Over 60% of the population is below 30 years. So if you look at that demography, it's pertinent that these people may be or will be those that will be mostly affected. But the other things have been attributed for people coming down with kidney disease at an earlier age. So there's a genetic predisposition that Africans generally tend to have to kidney disease. The gene that has been linked to that is called apolipoprotein 1, which has been found to affect about 45% of those in the southwest and about 30% of those in the southeast. So the presence of this gene mutation was discovered about 10 years ago, and it was postulated that this gene mutation, just like the sickle cell gene, is predominant among Africans. And in the first set of people it was described among African Americans, it was postulated and to be something that used to prevent severe forms of sleeping sickness among Africans. However, because that gene prevented them from sleeping sickness many centuries ago, it has now translated to something that makes people predisposed to kidney problem. Instead of preventing or helping to ameliorate kidney problem, the presence of this gene mutation actually puts blacks at risk of kidney problems. So that's one reason. The other thing that we found in our environments is the fact that health insurance doesn't cover more than a certain percent, probably 1% of the population, especially the working class. And so you discover that if people can't afford health care, they will have to resort to alternative practitioners or alternative therapy. And many of these alternative therapies are not regulated. They are not regulated like the orthodox medicine that has been around for many centuries. And many of the drugs that we use in the hospitals have been tested in animals, they've been tested in normal people, they've been tested in people that have disease. And there's a profile of side effects of all these drugs. But these alternative therapies are not regulated by anyone. Yes, the regulatory authorities tries to put a registration mark on some of them, but the honest thing is that many of these things have not been tested very well for their long-term effects on people. And so you may have drugs that or alternative medications that work, but their side effects can be much more devastating than the therapeutic effect it does have on such people. So people resorting to alternative therapy is also one reason why we have had a surge in kidney disease and hypertension. Then we also know that, for example, women who are of childbearing age, some of them may develop pregnancy-induced hypertension and may have some of the underlying medical conditions called connective tissue disease. And these conditions are known to cause subfertility or frequent pregnancy losses among women. And so when women come down with these problems, for those that do have it, they may not be diagnosed early and they might end up with advanced stage of kidney failure that will need for them to have dialysis and then subsequently a kidney transplant. So those are about the reasons why in our environment we seem to see it in the younger age population compared to developed climes. So on the next episode of Talk Sessions, we'll be looking at the relationship between the heart and the kidneys. My name is Dr. Umeizudike Theophilus. See you then.